Thank you very much. Thank you for that introduction. I'm delighted to be here today at this conference, this important conference. I want to thank Pat Harvey and his colleagues for the invitation, and also to take the opportunity to thank and to commend the Alcohol Forum for the work that you do, and to wish you well with the National Alcohol Awareness Week. I don't think I need to tell anybody in this room, talk to people in this room about the damage that problem drinking can do and can cause. It doesn't only harm the individual drinker, the individual involved, but also harms the lives of those close to them, their partners, their children, and their friends. It's right that so much emphasis is placed on individual responsibility, but Alcohol Forum, I would suggest to you, exists because individual responsibility alone is often not sufficient. What you do is you mobilise communities, bringing together parents, youth groups, community groups, sports clubs, schools, health services, businesses, law enforcement, to pool resources and to, in that way, to address and to deal with alcohol-related harm. A line that resonated with me from your own published material is, I quote, "Measures that influence the environment are more effective than targeting the individual drinker," unquote. Now, I don't think this is to absolve, as it were, anyone of individual responsibility to deal with perhaps their own problem behaviour, but it is to say that we deal with problems more effectively when we work together than when we work alone. The theme of this conference today, the power of community in reducing harmful drinking. I think it's an extremely timely, very important theme, because the problem that we're discussing and debating, looking for leadership on and looking for ways forward on, it's too big and too entrenched to be dealt with effectively on an individual level, or even perhaps on a community level. I want to give some examples of what I mean by this. And because the complexity of the problem, as we were told earlier, was touched on earlier, the fact that it has defeated us, I think, was a phrase that was used earlier, because every time that we put forward a reason for doing something, addressing the problem in a particular way, it seems that there are 5 or 6 or 10 reasons why we shouldn't do it. So just a couple of scenarios that I think we'd all be familiar with. Schools and parents tell our children that alcohol can be dangerous and must be approached very carefully. Undoubtedly, that is the kind of advice that children get in school and at home. At the same time, these same children who are getting this important advice and guidance from parents and teachers and elsewhere, those same children see advertisements on television and in cinemas and elsewhere at all hours of the day, telling them that drink is fun, is consumed by cool and good-looking young people, and is an essential part of social success. So how do we expect children to navigate those conflicting messages? Sports clubs tell our children and teenagers that good sporting performance and good health are generally incompatible with significant alcohol consumption. At the same time, their sporting heroes are kitted out in branded gear. The stadiums where they play or the backdrops against which they conduct interviews for the television are emblazoned with the branding of alcohol drinks. Again, how do we expect people to navigate those conflicting messages? Similarly, many elements of vibrant, healthy communities are here today, and they all do their best to protect their communities from the ill effects of alcohol. At the same time, through those communities and in those communities, there are massive billboards, ads on bus stops, on buildings, on the buses themselves, representing booze as an experience that helps you transcend your mundane life and enter a world of beautiful people, sporting success and happiness. Meanwhile, throughout these communities, there are supermarkets, off-licensed petrol stations, and even newsagents selling naggins of vodka for £5, bottles of beer for less than 50 cents. Again, I ask, how do people, and particularly young people, how are they expected to navigate those conflicting messages? And what is the message that we intend actually communicating to young people in these circumstances? So there's a clear disconnect between what we as a society want to say to young people about alcohol and what they are actually hearing. Young people crave acceptance. They're being bombarded with messages telling them that they will gain acceptance through alcohol. This is the reality of our world. So this is where governments, one area at least, where government clearly have a role. To act in support of the individuals and support of the communities that are working to deal with the alcohol problem, yes, but also to bring forward concrete change, concrete legislation where that's necessary and where that's appropriate in order to change the environment that we have created. Because we have created that environment. Every time governments decide to consider some form of regulation in order to address the problem, whether it's sponsorship, advertising, how and where alcohol is sold, pricing, there are always voices that will say, that can't work, that won't work. I've heard it quite a few times. We're told that we shouldn't consider restricting the sponsorship of sporting events because such sponsorship doesn't increase consumption. We shouldn't bring in minimum pricing because this will only lead to cross-border shopping. I hear arguments made against even something as straightforward as clear health labelling of alcoholic drink. Arguments against restricting advertising. Indeed, I've heard an argument against every single measure that has been proposed. There hasn't been a single measure that has been brought forward in the process, the substance misuse strategy report, and all of the related reports and analysis and advocacy. I doubt if there's a single proposal amongst those many proposals that doesn't have an opponent, and sometimes a very powerful opponent. But despite all of this, the government has been considering precisely these kinds of measures, and will announce conclusions, and not just proposals, but actual decisions. And I can tell you that that will be done shortly. And it is true that as government, we have to weigh up all of the different arguments before deciding how to proceed. We can't avoid that. I mean, that is one of the responsibilities of government, is to weigh up arguments and to weigh up what's said. And that can include dealing with the issue of different interests and conflicting interests. But decisions must be made, and that's what governments are there for, to make decisions. And in this entire area, we're not alone in Ireland. Governments across Europe and elsewhere are looking at ways to tackle the alcohol problem. Some have already taken measures, some very impressive measures. Others are considering measures, the kind of measures that we're also addressing. So it's a very live debate and discourse internationally as well as in this country. I can't give you the final details or the precise contents of our action plan, but I want to make one thing clear to this conference this morning. We won't be deferring our decision. We won't be commissioning more research, at least not for the moment, or deciding to wait and see how other countries get along. We won't be doing that. The National Substance Misuse Strategy Steering Group report was published last February, over a year ago. It provides us with a very robust analysis of the problem, and it also makes recommendations based on a thorough review of the national and international evidence. I stress evidence. We have a good track record, I would suggest to you, in this country as leaders, not as followers, but as leaders when it comes to introducing measures to protect our health and our environment. We led within Europe on banning smoking in workplaces, and others have followed our lead in large numbers. We took the lead again in taxing plastic bags with excellent socially beneficial results. Those who resist certain of the measures that we're bringing forward occasionally do make one reasonably valid point, and that is that it's difficult to take measures in a single small country if they're not taken in other countries as well. It's possible, for example, that minimum unit pricing in one country could lead people to buy their alcoholic drinks in another country. That's why, in addition to our own national initiatives, we're working with others who have the same public policy objectives that we have. For example, in conjunction with Northern Ireland, A health impact assessment has been commissioned to study the impact of different minimum unit prices on a range of areas such as health, crime and likely economic impact. So an important north-south dimension to this aspect of what we need to do. We will watch what other countries do and we will learn from them, but we will also take a lead. Yes, whatever we introduce, I have to say to you, will be a work in progress in the sense that it won't be the last word. I don't think anybody believes here that there's just one package that will deal with these challenges for all time, but it will represent an extremely important step forward. There'll be voices arguing against some of what we were doing. As I said to you already, there'll be some voices arguing against everything that we propose. Not everybody argues against everything, but different people argue against different aspects. And when you put them all together, it actually works out that there's somebody against all the measures, if you understand my point. We're not going to wait. We're not going to delay any further. This generation of children and young people will not wait. You who work so hard in your communities to get across the correct message about alcohol in the face of very powerful alternative messages cannot wait. I want to applaud and salute the work that you all do, and I hope that the steps that we are shortly to announce will make your job easier, as it were, and create a more appropriate environment in which to bring up our teenagers and our children. There are many elements, as you know, to the Substance Misuse Report's recommendations, all of which are evidence-based. Those relating to minimum pricing, availability of alcohol, forecourt selling, how shops are laid out, such like, are aspects that have been discussed in the public arena over recent months. Less discussed, perhaps, and this brings us to the theme of today, has been the need to mobilise communities. Mobilisation in this context needs to take place at both a national and a local level. The Alcohol Forum has been active on both fronts. For instance, at a national level, along with others, in promoting a coalition, Ireland Against Harmful Drinking. But at today's conference, the emphasis is more on mobilising communities at a local level. Alcohol Action Ireland, too, have been very active over the years in guiding and advising policy and in creating public awareness. Their perspective on this theme will be of keen interest to us. As an aside, can I take the opportunity to acknowledge the great work done by Fiona Ryan, the Chief Executive of Alcohol Action Ireland, who's now moving on from her post, and I would like to congratulate her on her move and wish her well. Not sure if she's in the room at the moment, but I think she's expected later. I'm aware that the Alcohol Forum plans to take what they have learned across the country, and I've read very much of the work, the huge work and achievements of Alcohol Forum. You intend taking those, what you've achieved there and what you've learned across the country and cause it to be, as it were, exploited and followed in other parts of the country. You intend working with other existing organisations that already have a strong presence in local communities. In particular, strong links are being forged with the network of family resource centres. A compliment to the family resource centres for their ready receptiveness to this initiative. The schedule of speakers this morning and throughout the conference is very impressive, Mr. Chairman. I want to acknowledge Dr. Anne Hope's presence. No doubt that her contribution will be very significant and most helpful and insightful. I extend also a warm welcome to Dr. Sheffield, clinical psychologist from Zurich University, and his recent related study on adolescence will be of enormous interest to us, I know. The story of endeavours by the Alcohol Forum, led by Anne Timley Meehan, and those of other initiatives, for instance in Ballymun, which will be presented by Hugh Greaves, will be an important session also. These presentations will tell us of initiatives taken, the evidence behind them, and the impact being made and to be measured. Finally, we have a very interesting soapbox session accompanied by a panel and plenary discussions involving my sometimes radio sparring partner John Waters of the Irish Times, John Logue of USI, Dennis Bradley. I also welcome and delighted to meet and to see Eamon O'Kane and Fiona Ryan that I've already mentioned. And your chairman, Mr. Tom Frawley, Northern Ireland Ombudsman, his interest and knowledge and chairing skills, I'm sure, will guarantee a very successful session. Before I conclude, I'd like to acknowledge the HSE and the CAWT, who've been closely involved with these community initiatives, and I'd like to urge their continuing support, which I know will be forthcoming. My thanks again to Pat Harvey, chair of the Alcohol Forum, to his board, to the staff for the work done in pulling this important conference together today, to all of the speakers, contributors, to yourselves. I'm sure this conference will be a great success. Thank you for inviting me to open it.